we spent the last few videos in this series talking about breast reduction, what that involves, and what the initial recovery is like. I wanted to spend this video talking about risks and complications of breast reduction surgery. This is extremely important because the more comfortable patients are with the procedure and the more that expectations are realistic, the better patients really do. I also said in the beginning part of this series that breast reduction surgery is extremely rewarding because it has a very high patient satisfaction rate with a very, very low complication profile. So let's talk about some of those things. You've heard me say this before. Any surgery, no matter what it is, plastic surgery or otherwise, has the general risks of bleeding, infection, blood clots, and anesthetic complications. Those are very low for breast reduction surgery, probably less than 1%. The risks that we talk about or that we focus on in the office are really those specific to the breast. So obviously we're going to be putting scars on the breast, so poor scarring is a risk and highly dependent on technique, but also on the patient's skin and how we look after this. So we employ a very careful and monitored scar management routine so that we can try to ensure that scarring is as minimal as possible. Because we're moving the nipple into a more elevated, lifted position, there is going to be scarring around the nipple internally, and that can affect two main things. Number one is breastfeeding, which I tell patients is 50-50. There's a lot of studies out there, but the data is not great. If breastfeeding is really important to you, I always recommend that you wait until after that period of life before having a breast reduction. And the second is sensation, for the same reason. The more incisions there are around the areola and the more scar tissue there is, the more we have issues with sensation. And that can be hypersensitivity, usually temporary, or it can be some numbness around the nipple area. And that almost always is present temporarily, but sometimes can be permanent. The other risks are what I like to call dynamic changes. So most of our patients are going to go through many different stages of life, whether it's childbearing, breastfeeding, hormonal changes with menopause, and general aging. And so breast reduction surgery doesn't prevent all of those natural life changes in a breast, but it does put you at a very good starting point. And so the breast will continue to change, and in patients that have breast reductions done at an early age, often a lift or a further reduction later in life it can be recommended and is certainly possible. And I would say the last thing, which I counsel all patients on because of all the work I do in breast cancer surgery, is breast cancer monitoring. So breast reduction surgery shouldn't interfere in any way with breast cancer monitoring, but of course the radiologists in the future, when they're doing mammograms or ultrasounds, will see scar tissue within the breast. They can tell that they can tell the difference between that and breast cancer, but if they ever can't, then they would do a biopsy. And so some patients that have had breast reductions or any breast surgery, in fact, may have more biopsies than somebody that hasn't had any surgery. So those are the general risks or the more common things that I talk about with patients. In the office, when we're considering breast reduction surgery, we go through literally the entire list so that patients are totally comfortable. But this gives you a pretty good overview. If there are specific questions, as always, I'm happy to answer them. Please put them below or get in touch with me and I'll do my best to share. Thanks for following.